Hi, Jones family. So today we are going to talk about some assessment teaching. Um, so for the introduction, we are going to talk about chronic illness management, infant and child care, home safety, and then a couple family resources that you guys can use. Okay, so the first topic that we're going to be talking about is chronic illness management. Okay, so first I want to discuss type 2 diabetes mellitus because I know mom, you struggle with type 2 diabetes. So the points that I wanted to hit on are exercise, weight management, and medication management. Um, so for in terms of exercise, it's important to aim for at least 150 minutes per week of, aerobic activity, such as brisk walking, and spread that over at least 3 days. You should do strength training exercises at least 2 to 3 times a week to improve insulin sensitivity. And you should avoid sitting for long periods. So it's important to move every 30 to 60 minutes. And then since you have that sciatica, you can start slowly and then increase your activity as tolerated. And then in terms of weight management, even a weight loss of 5 to 10% can significantly improve your blood glucose levels. So you should focus on protein control, portion control, um, increasing vegetables, whole grains, and lean proteins in your diet, and limiting sugary drinks and processed foods. And then you should encourage small, realistic goals instead of drastic dieting, which is often not successful. So just be mindful of that. And then for your medications, I know that it's been hard managing your medications because of financial strain, but we're going to talk about some resources at the end to help you with that. But in terms of medication management, you want to take your meds exactly as prescribed. Do not skip doses, even when you're not feeling well. And then understand the timing of when you need to take your medications, and then report side effects such as dizziness or GI upset to your provider. Um, and then for blood glucose monitoring, which goes along with medication management, you want to check your blood glucose as recommended by your provider. Um, Keep a log of readings to identify patterns, and know your target ranges. So for fasting blood glucose, um, usually your provider will tell you kind of where they want it to be, but in between 80 and 130 is okay for fasting. And after a meal, it should be less than or equal to 180. Um, and lastly, for type 2 diabetes, I want to talk about some signs and symptoms of both hypoglycemia and hyperglycemia. So hypoglycemia means that you have low blood sugar. So that is defined as blood sugar less than 70. So with that, you might see shakiness, sweating, confusion, irritability, headache, dizziness, or a fast heartbeat. So what you should do, you want to consume 15 grams of a fast-acting carb, such as juice, or glucose tablets, crackers, something like that. And then recheck your blood sugar in 15 minutes. And if it's still low, repeat that process. And then for hyperglycemia, you may see, which is high blood sugar, you may see increased thirst, frequent urination, blurred vision, fatigue, or headache. And then when it's severe, you could see nausea or vomiting, fruity breath, or confusion. Um, so with diabetes, you should seek help if your blood glucose is consistently above the target range, you have frequent hypoglycemia episodes, or you have symptoms of severe hyperglycemia or dehydration. Okay, the next thing I want to talk about is sciatica, of course, for mom. So I want to first talk about pain management without, costly treatments. So you can use over-the-counter medications such as ibuprofen or acetaminophen as directed. You want to check with your provider to make sure that that is okay. Another thing that you can do is apply heat. So you can do a heating pad, a warm towel that you warmed up in the microwave, and that'll help relax your muscles, or you can use ice to reduce inflammation. But only use ice for about 15 to 20 minutes at a time if you're going to use that. Next, it's important to be mindful of safe movement and activity. So you should avoid long periods of sitting and change positions every 30 to 60 minutes. So, like we discussed with diabetes, getting up, moving, changing positions, that'll be also good for your sciatica. And you want to, every day do some type of light activity, such as short walks instead of bed rest, which can actually worsen your pain. So you want to limit bed rest actually. And then for walking, if you feel safe in your environment, you could use sidewalks or safe, areas such as indoor stores for walking. Um, and then also at home, you could do some simple stretching. So those could be needed chest stretches or hamstring stretches. But it's important to note that if the pain is worsening, um, stop because the stretching should feel relieving and not painful. Another thing to keep in mind is proper body mechanics. So when you're lifting, especially your 3-month-old, you want to bend at the knees and not at your back, and keep objects or, the infant close to your body. And then avoid twisting movements while lifting. That's especially important. Next, I want to talk about sleep and rest positioning. So, it could be beneficial for you to sleep on your side with a pillow between your knees, or on your back with a pillow under your knees to reduce the pressure on the spine. And you can use affordable pillows or folded blankets if you need to. Um, and then for work, I know you said that you're a waitress. So for work and for daily activities, it would be good to invest in some supportive and comfortable shoes. Take short rest breaks during work when possible, and alternate tasks to um, avoid repetitive strain. And then for at home, you should use chairs with back support instead of soft couches that will worsen your posture. And you should avoid sitting on low or sagging furniture for long periods. And then, knowing when to seek medical care. If you have pain that is severe, worsening, or is not improving, you have numbness, tingling, or weakness in the legs, or loss of bowel or bladder control, which is a medical emergency. So you should seek help immediately for that. And then just, to quickly touch on resources for your sciatica, Medicaid covers visits for evaluation and possibly physical therapy. So you should look into that. And you can ask clinics about home exercise programs to avoid repeated visits back and forth, since I know transportation is a barrier for you all. And then lastly, stress and pain. Stress can actually worsen pain perception. So to manage stress, you could do some deep breathing, short relaxation periods, and then continue to maintain that supportive family environment at home. Okay, so next I want to touch on depression because I know, Dad, you've been dealing with a bit of depression. So one of the things about depression is it is good to establish daily routines. That means sleep, routines, meal routines, and activity routines. It's important to stay active to improve your mood. Um, and then you should talk to somebody that you trust, such as a trusted family member or a counselor. I know you said that your parents are very supportive and involved with you and your family, so it might be good to talk to them. and just in general, do not isolate with depression. And then I know you also are struggling with a bit of alcohol use disorder. So, the thing with alcohol is that it actually can worsen depression symptoms. So, um, it's good to, get a handle on that to avoid worsening your symptoms. And then lastly, you should seek help immediately if you're experiencing hopelessness, loss of interest, or suicidal thoughts. That is a medical emergency and you should seek help. Um, and I want to quickly touch on a local resource that I'll discuss more about a little bit later. The Forsyth County Behavioral Health Services. They provide crisis support, counseling, and connect patients to care in the community. So that could be a good resource for you and your family. Okay. And then alcohol use disorder. So, as I mentioned before, alcohol can worsen mental health, finances, and family stress. So, it's important to, start managing that disorder. But with that being said, it's also important not to stop alcohol use suddenly without medical guidance because of the risk of withdrawal. Um, so to manage this disorder, you could join support programs, counseling, or medication-assisted treatment, and identify triggers for alcohol use, such as stress or social situations, and develop healthy coping strategies. And I wanted to talk a little bit about the Novant Health Forsyth Medical Center Behavioral Health Center. They are located here in Winston-Salem, and they are for both opioid and alcohol use disorders. And they use medication-assisted treatment with agents such as buprenorphine and naltrexone as clinically indicated. So those are some medications that can help with the alcohol use disorder. They also integrate counseling and relapse prevention planning. So, I know that finances have been a barrier for the family. So I also wanted to let you guys know that they take Medicare, Medicaid, some government funding, and they offer services to both insured and uninsured patients. Okay. Lastly, I wanted to touch on asthma. So, it's important for your child to use a daily controller inhaler as prescribed and not just the rescue inhaler. The inhaler is going to help control asthma so that the rescue inhaler is not needed. And then you should also identify triggers such as, smoke, dust, cold air, just what is causing an exacerbation in these asthma symptoms. Um, and also, it is important to keep the rescue inhaler available at all times, just in case you run into one of those triggers unexpectedly or, whatever the case may be, keep a rescue inhaler with you at all times. Um, and then seek care if wheezing worsens, the rescue inhaler is not working, or if your child is having trouble speaking or breathing. Those are medical emergencies, and your child needs to be taken to the hospital immediately or something like that. Okay, so topic number two, I wanted to briefly touch on infant and child care. You guys have been doing a great job, but I just wanted to add a couple more points that I think may be beneficial for you all. Okay, so as we discussed, these were a few of the issues that we identified going on. So for diaper dermatitis, it is important to, excuse me, just one second. Yes, for diaper dermatitis, you want to keep the child dry. You can use a barrier cream or something like that, to prevent, the moisture from the urine from staying on the skin. And then in terms of child safety and supervision, never leave the children unattended during bathing because of the risk of drowning or slipping. And then check the water temperature before you put the child or the infant in the water to prevent burns. And then you want to keep hazardous items out of children's reach. And then ensure safe sleep with your infant. So they need to sleep on their back, no items in the crib. Do not sleep with the infant in the same bed. Things like that prevent SIDS or sudden infant death syndrome. So that's very important. Um, and then where the children sleep or play, you want to keep those areas hazard free. So no loose items or fall risk items there. And then lastly, I think that you should teach your 4-year-old basic safety skills, such as, don't touch the stove, recognizing what's dangerous, fires, things like that, and how to get help. So if your toddler does not know 911, teach them that number so that they'll understand who to call in an emergency. Um, and then in terms of the sleep routines for the infant, like I discussed before, place them on their back to sleep. Use a firm mattress with no loose blankets or toys, and establish a consistent bedtime routine. So, first maybe feeding, then a diaper change, then quiet time. And then expect frequent night waking, for right now, because she's at that, 3-month age, but also keep the environment calm and quiet. And then for your preschooler, set a regular bedtime and wake up time daily. Create a calm routine, such as maybe a bath and then a book and then a quiet activity before bed. You also want to limit screen time before bed and ensure that the child is sleeping in a safe and comfortable environment. Okay, so topic number three, we are going to discuss, first we're going to discuss burn prevention. So I noticed that you guys said that your water heater is set at 140 degrees Fahrenheit, which is currently an unsafe temperature. So you want to aim for 120 degrees Fahrenheit to prevent burns, especially in children. But if your temperature cannot be adjusted, you may want to think about installing anti-scald devices, and always test the water before bathing. And then, as I mentioned before, supervise your children closely around hot water, stoves, and then other heat sources. And then, of course, fire safety. So it's important to install working smoke detectors in all the bedrooms and in the common areas. So, with these smoke detectors, the batteries need to be checked and changed regularly, so at least every 6 months. You should get a fire extinguisher and you should keep it in an accessible location, such as in the kitchen. And then lastly, develop and practice a family fire escape plan with two possible exits if possible. I know you guys said you were having trouble with that back door, so it's important to get that fixed to maintain the two exits there. And then for fall prevention, you want to secure the loose carpeting in your home and repair the uneven flooring to avoid tripping hazards. Fix or replace unstable furniture such as wobbly chairs. Keep walkways clear of clutter and keep them dry to prevent slips, especially in the bathroom. I know that you talked about there's not really adequate ventilation. So what you could do is open a window while somebody is bathing or showering, just to, let some of that steam out so all the water is not collecting on the floor because that is a slipping hazard. And then I want to talk about kitchen safety. So, Mom, I know that you said that you often cook with loose clothing because it's comfortable, but you want to avoid loose clothing as much as you can while you're cooking to reduce fall risk. And then also you want to keep the children away from the stove and hot surfaces. And when you're cooking, turn your pot handles inward and never leave cooking unattended. And that's so that, your toddler doesn't maybe run by and accidentally hit the handle and, the hot food is going everywhere. That's just, not safe. So. Right. So, and then lastly, for emergency preparedness, like I mentioned before, repair that back door to ensure safe and reliable exit in emergencies. Keep the emergency numbers easily accessible on your cell phones. You might want to think about posting them in an easy to read location for your toddler, such as 911, so that just in case they forget that number, something they have it there, just in case of emergency. Yes, and teach your 4-year-old how to call 911, when to call 911, and how to state their name and their address, when talking to the 911 operator. And then also you want to review your emergency plan regularly so that all family members know what to do in case of an emergency. Okay, so the last thing I want to talk about with you guys is family resources, because of course all of this information is useless if you don't have any resources to help you follow through with it. So the first resource I want to talk about is the Forsyth County Department of Public Health. So what they do immunizations for children and adults. They have women's health services such as prenatal and postpartum care. They do chronic disease screening, so that could be helpful for, the diabetes or maybe hypertension. They do communicable disease testing and prevention, and they have medication assistance programs. So why I thought this would be good for your family. They support type 2 diabetes through screening and education. They provide well child care and immunizations for children. They offer low cost or free services, which is ideal due to your financial barriers that you discussed with me. And it can help you all obtain affordable medications and supplies. So next I want to talk about the Forsyth County WIC program. So that is for mothers with infants. So, I know you have the 3-month-old in the home. So they provide monthly food benefits such as milk, eggs, cereal, fruits and vegetables, and infant formula, nutrition and education counseling, breastfeeding support, and referrals to healthcare and social services. And why I thought this would be useful for your family is because it will help address your food insecurity and food desert challenges, support healthy eating for diabetes management, provide formula and nutrition support for the infant, and will reduce the financial burden on groceries. Okay, next, another food resource, Second Harvest Food Bank of Northwest NC. That is also located here in Winston-Salem. You can get access to free food through local food pantries. They have a mobile food distribution program, and they provide nutrition education initiatives. So, why this would be helpful for your family is because they improve access to nutritious foods despite limited transportation, support consistent meals for the entire household, and can help with diabetes-friendly food options when available. And this helps with diabetes, but also diet is important for depression. So if you're eating well, you'll feel well, and that goes for, both mental and physical disorders. Okay. So as I mentioned before, I want to touch more on the Forsyth County Behavioral Health Services. So they provide mental health assessments and counseling, substance use treatment programs, crisis intervention services, and referrals to community providers. They will help address depression, alcohol use disorder, provide access to affordable or sliding scale services, offer early intervention, ongoing support to improve your family functioning, and they can connect you to support groups and treatment programs. So, and this could be beneficial not only for a dad who's struggling with a bit of depression and alcohol use disorder, but anybody who needs somebody to talk to. Mom, I know that you guys said that this is a stressful situation, which I definitely understand. So, any type of mental health support, this is the resource for you. And lastly, I wanted to talk about Downtown Health Plaza. They provide primary care services for adults and children, chronic disease management. They have an on-site pharmacy with low-cost medications, and they also provide laboratory and diagnostic services. So I thought this would be helpful for ongoing diabetes and asthma management. They can help with medication affordability and access. It's a convenient one-stop location for the entire family, which reduces your transportation burden and supports continuity of care for the entire family. So this is somewhere that you could go for, your checkups, your screenings, any type of health interventions that are necessary. Downtown Health Plaza is your spot. Okay, so thank you guys so much for listening to my education. I hope that the education, the resources that I provided have been helpful for the family, and I wish you guys the best of luck.